Gallbladder 1 is located very approximately half a sun lateral to the outer canthus of the eye. Palpate laterally to find the lateral orbital margin. Mark your point just on the edge of that orbital margin. Be careful not to move back into this fleshy area because there are other points here. When a person opens their jaw, a groove opens up anterior to the tragus. Gallbladder 2 is located in this groove anterior to the infratragic notch. Gallbladder 3 is located directly above stomach 7. Palpate over the zygomatic arch and feel for a nice dip just above its superior border. Gallbladder 4 is located 3/4 of the distance between gallbladder 7 and stomach 8. Gallbladder 5 is located halfway between gallbladder 7 and stomach 8. Gallbladder 6 is located 1/4 distance between gallbladder 7 and stomach 8. Gallbladder 7 is located 1 finger breadth directly anterior to Sanjiao 20. Gallbladder 8 is located 1 sun directly superior to the apex of the ear. Frequently you'll find a nice groove in the bone just at this point. Gallbladder 9 is located half a sun directly posterior to gallbladder 8. Gallbladder 10 is located about 1/3 of the distance of a curved line joining gallbladder 9 to gallbladder 12. Gallbladder 11 is located a little over 2/3 of the distance from gallbladder 9 to gallbladder 12. If you palpate, you'll find a nice dip. Gallbladder 12 is found just a few fen anterior and inferior to the extra point peaceful sleep. Gallbladder 13 is located half a sun into the anterior hairline, 2/3 of the distance from the anterior hairline to stomach 8. Gallbladder 14 is located above the pupil looking directly forwards, one sun superior to the eyebrow. To locate this point you need to stand directly in front of the person, have them look forwards. Remember the distance from the centre of the glabella to the anterior hairline is 3 sun, which will enable you to calculate your 1 sun. You can locate this point in a dip that's formed when the brow starts to come away from the skull. Gallbladder 15 is located at the midpoint between do24 and stomach 8. It's half a sun into the anterior hairline. Gallbladder 16 is located on a curved line joining gallbladder 15 to gallbladder 20. It's 1/3 of the distance from gallbladder 15 to gallbladder 18, which is on a level with do20. This makes this your gallbladder 16. Gallbladder 17 is on a curved line joining gallbladder 15 to gallbladder 20. It's 2/3 of the distance between gallbladder 15 and gallbladder 18. Gallbladder 18 is on a level with do20, which makes this gallbladder 17. Gallbladder 18 is on a curved line joining gallbladder 15 to gallbladder 20. It's at the same level as do20. Gallbladder 19 is on a curved line joining gallbladder 15 to gallbladder 20, and it's on the same level as do17. To locate gallbladder 20, palpate up the groove in between the sternocleidomastoid and trapezius muscles. As you get to the base of the occiput, you will find a nice depression. Gallbladder 20 is in the centre of that depression. Gallbladder 21 is located midway between do14 at the base of C7 and the lateral extremity of the acromion process, but at the crest of the trapezius muscle. To find the crest of the muscle, it may be necessary to dip down slightly to make sure you get the highest part. This point forms a line with Sanjiao 15 and small intestine 13. Gallbladder 21.
Gallbladder 22 is in the 5th intercostal space on the mid-axillary line. The root of the breast falls into the 5th intercostal space. Palpate round to the mid-axillary line, level with heart 1. Gallbladder 23 is found in relation to gallbladder 22. It's 1 cm anterior to it, but still in the 5th intercostal space. To find that 1 cm anterior, find the midline and the lateral extremity of the acromion and divide that 8 cm down to find your 1 cm and put it forward anterior to gallbladder 22 and then palpate into the fifth intercostal space. Gall bladder 24 is fourth and lateral to the midline in the seventh intercostal space. When you palpate this point, make sure that you are in the intercostal space, not on the rib.
Gall bladder 25 is found anterior and inferior to the free end of the 12th rib. To find the 12th rib, palpate along the lower border of the back of the rib cage to see if you can find the free end of a rib that lies posterior to the mid-axillary line. It's not always possible to find this point in this position. It may be necessary to turn the person onto their side. Sometimes it's necessary to lay a person on their side to find gall bladder 25. Here it may be easier to palpate up the lower border of the 12th rib to find its free end and therefore gall bladder 25. Gall bladder 25 can also be found with a person laying face down.
Gall bladder 26 is directly lateral to the centre of the umbilicus, inferior to liver 13, which is at the free end of the 11th rib. Gall bladder 27 is found in relation to the ASIS. It's in a depression just anterior to it, at the level with Ren 4, or approximately at that level. Gall bladder 28 is half a cun anterior and inferior to gall bladder 27.
Gall bladder 29 is found midway between the anterior superior iliac spine and the greater trochanter. To find the greater trochanter, palpate up the lateral aspect of the leg until you find the bony protuberance at the top of the femur that is the greater trochanter of the femur. Gall bladder 29 lies halfway between these two landmarks.
Gall bladder 30 is in the posterior lateral aspect of the hip. It's at a junction from the anterior 1/3 and posterior 2/3 of a line taken from the prominence of the greater trochanter and the sacral hiatus.
Gall bladder 31 is located directly inferior to the prominence of the greater trochanter, 7 cun superior to the inferior border of the patella. To find the prominence of the greater trochanter, press the hips on either side to feel for a bony protuberance. To double check that you've found the greater trochanter, rock the leg from side to side and feel the bony protuberance moving underneath your hand. The distance between the greater trochanter and the inferior border of the patella is 19 cun. If you divide this distance into 3 equal units, each one of these units will be 1/6 of a cun. as the point we're after is 7 cm superior to the inferior border of the patella. It lays just a little above the superior border of the lower third. Gall bladder 32 is located on the lateral side of the thigh, 5 cm superior to the inferior border of the patella. If we divide the distance between the inferior border of the patella and the prominence of the greater trochanter into 4 equal parts, this point lies just a little higher than the junction of the inferior quarter and superior 3/4. Gall bladder 33 is located on the lateral aspect of the knee, in between the tendon of biceps femoris and the lateral epicondyle of the femur. To bring the tendon of biceps femoris into relief, have the person pull their heel back against the bed. You should be able to feel this tendon quite clearly now. When the person relaxes their leg, you should find this depression more or less on the same height as the superior border of the patella. Gall bladder 34 is located in a depression which is anterior and inferior to the head of the fibula. To locate the head of the fibula, find the tibial tuberosity and move laterally until you find a prominent bony landmark. Be sure that you don't confuse the head of the fibula with the lateral condyle of the tibia, which is closer to the kneecap. Gall bladder 35 is located 7 cm superior to the prominence of the lateral malleolus. It's at the posterior border of the fibula. If you can't find the posterior border of the fibula, raise the foot slightly to allow the flesh to drop away from the bone. This point is on the same level as gall bladder 36, but posterior to it. Gall bladder 36 is located 7 cm superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you're having difficulty locating the anterior border of the fibula, just raise the leg slightly off the bed to allow the flesh to move away from the bone. This should make it easy to locate your point. Gall bladder 37 is located 5 cm superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you're finding it difficult palpating the anterior border of the fibula, raise the patient's leg very slightly so that the flesh can drop away from the bone. This should make it easy to find your point. Gall bladder 38 is located 4 cm superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you palpate up from the lateral malleolus, feeling the posterior and anterior border of the fibula, it should be easy to find this point. Gall bladder 39 is located 3 cm superior to the prominence of the lateral malleolus. It's in a groove in between the lateral crest of the fibula and the peroneal tendon. Get your patient to avert their foot against resistance to reveal the peroneal tendon. Be sure to locate this point in the groove between bone and tendon, not posterior to the tendon. Gall bladder 40 is located approximately at the junction of the line drawn along the anterior and inferior border of the lateral malleolus. It's important to articulate the foot and feel for a nice depression here. Mark your point in the deepest part of that hollow. Gall bladder 41 is located on the dorsum of the foot in a depression distal to the junction of the bases of the 4th and 5th metatarsals. If you articulate the two metatarsals, you'll be able to feel a nice groove in between their shafts. Gall bladder 41 is located lateral to the tendon of extensor digitorum longus, little toe branch. If you extend the toe, this will bring this tendon into relief. Gall bladder 42 is located on the dorsum of the foot in a depression proximal to the junction of the heads of the 4th and the 5th metatarsals. If you articulate the metatarsals, you can easily palpate the groove in between the two bones. This point should be located medial to the tendon of extensor digitorum longus, little toe branch. To show this branch of the tendon, pull the little toe out. It's normally quite visible. Gall bladder 43 is located half a cun proximal to the web margin between the 4th and 5th metatarsals. Try and tuck this point neatly into the flare of the base of the proximal phalange of the 4th toe. Gall bladder 44 is the lateral nail point of the 4th toe. Be sure to mark this point clear of the nail bed and try and tuck it into the flare of the base of the distal phalange.